good morning, and I hope everyone's staying warm. It's great to be back in Bay County, to be here in Lynn Haven. I want to thank, I know we have Senator Gaynor here. I know we have Frankie Lum. I know we have the CFO, Jimmy Petronis. And I know we have a lot of great folks working on this. This is important. This is one site that's going to be replicated throughout the states in a number of different areas. But we really believe making sure these vaccines are getting into all segments of communities is important, and we think working with our houses of worship is one way that you can do that. So we had started doing one in Pensacola last Sunday, was very successful, and so today you're going to see 7 of these sites working today in conjunction with places of worship, many of them with predominantly African American churches. So we have here in Lynn Haven, we also have Tallahassee, Hollywood, Fort Lauderdale, St. Lucie, Tampa, and Jacksonville. So we're really excited about it. I want to commend the folks here in Bay County, Lynn Haven, all the churches getting together. They've done it really, really well. It's going well. People seem like they're really excited. They got a great system in there. You're going to be able to see a demonstration here in a second. But this is really exciting, and we're going to continue to do it. And I would note, when we were in the holidays, I said, look, there's not going to be a lot of a Christmas, New Year's period. Is it the hospitals, all this? If you look this week, you look at some of the numbers already, and they constantly get updated because they're not updated always every 24 hours. We're doing 50, 60,000 shots throughout the state of Florida, and we have throughput to do much more, and we're trying to get more vaccines. So we're excited about the progress. We do, though, want to highlight here, this is a collaboration between Bay County, Lynn Haven, the state of Florida, and we have 50 different houses of worship that are participating in this, who from around the area. So this is a lot of teamwork. It was the state providing resources. It was the city and the county working with all the churches to make it happen. And so they designated each church a certain amount of times to receive. And then the pastors would work to be able to bring some of the senior citizens for those particular times. So we have a whole bunch of churches here, and we're really excited to do that. And they're going to do 500 vaccinations here today. And what they'll do is everyone will get a card when they leave, and they'll come back, and in 4 weeks, if they're using the Moderna, which I think they are, then they'll get their booster shot, and they'll likely do it right here as well. So our priority is to provide vaccinations for 65 and up, our senior citizens. We're putting seniors first. We're doing it in a variety of ways. You see some of these big hospital systems are now starting to crank out a lot of vaccinations. We appreciate that. You also look at some of the county health departments working in their communities to get seniors vaccinated. You look at some of the drive-through sites that the state's supporting, as well as some of the locals all throughout the state of Florida. That is something that's been very convenient. And then our partnership with Publix. I had the opportunity to go to Hernando County yesterday. We started with Marion, Hernando, and Citrus counties, and I can tell you they're doing a fantastic job. All the seniors I talked to are really thrilled with it. We'll be making another announcement this week about expanding that footprint, so we're going to continue with the momentum. But we've got about 250,000 seniors that have been reported for vaccination already, and you're going to see more reported just on the reporting lag, and then obviously we're doing it more every day. So that's what it's about. It's about being there for our senior citizens. We're going to keep working hard until every senior who wants it is able to get it. Hopefully, we're scheduled to get about 250,000 additional vaccine shots, first doses next week. I would like to get more. I've asked if we could potentially get more. I can tell you with the throughput we have now, we'll burn through that without question. And we know who's doing it well. We know where to put the vaccine. We've been able to beta test a lot of different ways. And I think that you're going to start to continue to see a lot of great progress. So I'm going to let Jimmy Petronis come up, say a few words, and then we'll do the demonstration.
Thank you, Governor. Good morning, everybody. Thank you so much for being here today. It's been a challenge. COVID-19 has changed the world. Before COVID-19, back in January, the sky was the limit for the state of Florida. The economy was white hot. But Governor, on behalf of the folks of Bay County, Lynn Haven, myself, my family, thank you so much for what you've done as you have led. You took the virus seriously, and you took keeping Florida's economy open seriously. we're in an environment right now where, you know, there's critics. Everybody feels like there's a better way to do this. But all I know is every single day, to the tune of over 900 people a day, are moving to the state of Florida because of the leadership you've shown and what we see that is taking place in Florida, and not in the New Yorks or the Illinois or the Chicagos or the Californias. People are talking with their feet, and they're moving where they feel safe, they're moving where they can have quality of life, and they're moving where they can raise their family. COVID-19's bad stuff. Every single one of us has a dear friend, a loved one, or even a family member that's died from it, and our prayers are with them. But this is, today, what you see, this is a light at the end of a very, very dark tunnel. And vaccine is going to be the game changer as we see it deployed out. So today, as you have prioritized putting our seniors first, our 65-year-olds, I was teasing Senator Gaynor. I said, "You're not 65." Actually, he's a little older than 65, but you know, but that's exactly who we need to take care of. We need to take care of our mamas, our daddies, our grandfathers, our grandmothers, and those folks that did so much to give us so much. So, Governor, again, thank you. Your urgency is saving lives. God bless you, and God bless your family, and God bless the state of Florida. Thank you, sir.
Thanks, Jimmy. So what we have, we got two great folks here that are going to do it. So they've just so you know the process, they go through. Obviously, they have to register. They have to sign a form, just understanding what they're about to be given. And then then in there is really where they're doing most of the shots. They're willing to brave the cold to be able to show everyone. So they do the shot, and then they have a waiting area where people can wait just to be observed for 15 minutes. Now, we haven't had really any problems, but that's just being safe. And then once that's done, they get a card to come back in 4 weeks, and then they're on their way. So soup to nuts, pretty efficient process. And why don't you guys go ahead and let her rip?
Go Heather!
No pain.
No. You got it? All right. There you go. And I've been able to witness probably I don't know, 50 or 60 of these over the last few weeks, and it's been just like that every time. You know, no worries. Get it done and move on. I was able to, as I mentioned, I was able to go to Hernando County yesterday and speak with, I visited 4 different Publix stores, spoke with the pharmacists, spoke with the seniors who were getting it. I was able to speak with the leadership of Publix, and you know, people are excited to be able to be, you know, in this day. I mean, there's a lot of people that have had a lot of isolation, and they haven't been able to do a lot of the things that they wanted to do. So to be able to do this, you know, you saw people that had tears in their eyes. They were so happy. So we're going to continue to work hard to do it. I will say, as I mentioned, we look to see what works. We like what we've seen with the Publix. So we're going to be making an announcement, some more announcements on that soon, as well as if we get additional vaccine, other ways to do it. And I will be back in Bay County this coming week for additional ways for people, for our seniors to be able to access vaccines. So stay tuned for that. We look forward to being back here in just a couple days. And with that, I'll take a couple questions before everyone gets back to the warmth. Yes, sir.
Governor, there's been some issues with people signing up and being able to get in. Has the state looked at to maybe trying to make that a little bit easier for senior folks?
Well, so I think that the issue is like when you sign up. So for example, you know, if there's we have a test site we're doing, we converted to vaccine down in Miami. You know, people can call in. It fills up very quickly. I mean, when you have when the hospitals are putting this out, it is filling up very quickly. If you can't get in now, just hang in there, because not only is there going to be more opportunities in the future, if we get more vaccine in the short term, we want to get that out, and so you may be able to sign up very soon. So, but I think the hospitals, when they've had issues, they've been able to deal with it. I know some of the counties did, and then they've been able to help with it. So we've put some more resources into phone lines. So when you go down to a place like Miami-Dade at Hard Rock, if people want to go there, they can call a number. Some of the other places that are doing it are doing it more online focused, and that's fine. But I think what you're seeing is, I think you're seeing it, regardless of the venue, I think you're seeing it work better. And when I was talking to the folks, for example, with Publix, they thought it was very easy, very convenient. So we obviously want to do that. I mean, if you have someone that wants the vaccine, we want them to be able to make the appropriate contacts so that they can get in the queue. But just understand, when these things fill up, it doesn't mean that they're filled. I mean, we're going to continue to bring more vaccine and then offer that. And it may not mean you have to wait weeks and weeks. I mean, if we get more dumped, then you offer more appointments as soon as you can.
Governor, some lawmakers have expressed concern about people jumping the line, so to speak, donors and people with connections getting vaccinations, and then some also providers charging for vaccinations. Are there any penalties for that type of activity?
So the question is, you know, are you going to go outside the criteria? We want to focus on our criteria. I don't want people going outside. You know, we have nursing home staff, nursing home residents was the first, some of the frontline healthcare workers, and then 65 and plus. And that's really where it's got to be. You know, going around that is not what we're looking for. You know, I don't know about necessarily penalties or what. I mean, I think if someone's not doing it right and they're not following what we want, then obviously we can distribute vaccine to other places instead as we go forward.
And any word about there's still growing concern for teachers to get in front of the law?
Excuse me?
There are still calls for teachers, and I know you're focused on seniors right now, but what are next steps?
Well, obviously, I mean, you're going to have a lot of folks to be in that next cadre for sure. But, you know, by us putting seniors first, we're doing the right thing by our parents and grandparents. It's the morally right thing to do, but it's also the medically right thing to do. It's based on the data. The fact of the matter is this virus has been more deadly to people who are elderly than the people who are young or middle-aged. And so by focusing on 65 and plus, that is the best thing we can do to reduce both morbidity and mortality from the coronavirus. And so it's not saying that anyone's more important, quote unquote, than others. It's just simply saying we've got to stand by our elderly folks. If this were something that were attacking young people at the same level and not elderly as much, then we would focus in a different direction. But we understand the data, we understand where the risk is, and we're going to make sure that we're putting seniors first. Now, I hope that as we have new vaccines available, such as the Johnson & Johnson, we're waiting for that in terms of the clinical trial data, and then if they file for emergency use authorization, that could happen within the next 4 to 6 weeks. And that is a one-dose vaccine. You don't got to put it in the freezer like you do the Pfizer or even the Moderna, and that can be widely, I think, distributed. So that would be the easiest thing for a lot of people in the workforce. So we're going to continue putting seniors first. There's way more demand from seniors than there's been supply so far. That will start to change. I mean, as the supply comes in and more people get vaccinated, you're going to start to see that become a little bit more, I guess, a little bit better equilibrium there. And then at that point, we can start looking for folks, you know, who want to get it. And I'm confident that if we do get something like Johnson & Johnson, we're going to have a lot of that. They produced 100 million doses, and all you need is one dose. So you get that out into society, and I'm confident people are going to be able to have access to this. But we are putting seniors first. We're going to be there for our parents. We're going to be there for our grandparents, and that will do more than anything else we can do to reduce mortality and change the scope of how this virus behaves in the state of Florida. Thank you, everyone. We will be back to Bay County very soon this week. Thanks, guys. Appreciate it. Appreciate it. Thanks so much. We appreciate you guys. Thanks for what you're doing. Thank you.
Appreciate y'all. Get up there.